Hi, it's Dr. Jeff Pierce from Michigan Sports and Spine Center, here with our 23rd week. We're still able to count them. So today's a fun day, hopefully. Middle of the month, going into October, everybody's looking forward to Halloween. I think we're all just craving to do something. So the big question is, what are you guys going to do for Halloween? Are we trick-or-treating? Are we handing out candy? What are the kids going to do? They can't be cheated. Someone actually asked me, I don't know if you know or someone can let us know, is Greenfield Village doing their Halloween thing and the party? And I know some of our extended care facilities and nursing homes are trying to do something by the cars where they set up the cars apart and they do it out of the trunk of the car. So what's the creativity that we're looking for Halloween this year? Obviously we're not promoting candy, but we are promoting candy because I'm still a little kid at heart, and I've been told that by many people. So I love the Halloween theme, the ideas. So exciting times, and our weather's been perfect. Getting into the first question, because I'm going to stay apolitical today because Nicole's already giving me the eyes. But if anything, we'll just say we all do need to get out and vote. I will push that. Everybody should be getting out and voting. And express yourself that way, not through all this anger, because we need a lot of anger management after some of these things. Getting it back into what we do and we specialize in. Question 1, if medicine is needed for my lower back, how does the medicine work? Aren't there side effects to pain medications? So when we say medications, what we try to do and what we're known for, especially at Michigan Sports and Spine, our philosophy is less is more. When we say less is more, we're talking about medications mostly. We do not, if anybody calls me a pain clinic, I correct them right away. We are not, and I'm correcting you here, we are not a pain clinic. We've never been a pain clinic. I've never put pain clinic into our titles, into our stuff that we market or on our website. We define ourselves as a spine care center. We're an aggressive spine care center. We use medications that are needed at the time they're needed, but we are not a pain clinic. So when I have patients that are looking for pain clinics, those are usually the people that rip me on my testimonials and stuff, that he doesn't understand, all that. I do understand. I understand at the fullest length and what it can do to you long terms. Typically what I do, when I look at things that I do, I look at what's going to happen, not just today, but what's going to be down the road for 3 months, 6 months down the road. That's where I'm looking. Like when I start talking, especially with young people, I had a young individual here yesterday. I'm looking at it. You've already have a back pain issue at the age of 16, which is very similar to what happened to me at 15. You have a long-term problem that you're going to have to deal with. So the doctor that just hands you a Motrin and says, you'll be fine, that's the last thing you want to hear. That's not the doctor you really want to go to. You want to go to the doctor that understands how to fix it today and talk about what's going to happen in years to come. Like I always talk, even with my old kids, my kids are active. They've been injured in sporting activities, and I'm telling them, they walk around every day, one of them has something wrong. I'm like, what are you going to be 20 when you're 30, 40, 50 years old? That's what I get to live and talk from now. Before I just predicted it. Now I've actually lived it, so I know firsthand of what's actually happening because I was a back pain patient at the age of 15. So I really didn't address the question, but I've pushed it off that medications are important. They're important for that short run. Like if you have inflammation, we give you an anti-inflammatory. If you have that muscle spasm, we're giving you an a muscle relaxer. If there's narcotics or you're having pain, our country has been criticized that we write more pain medications than the rest of the world. That's a true fact. I don't want to be part of that fact. We try to keep you from it. I use appropriate pain medications, and yes, they do have side effects, let alone everybody hears the narcotic, the opioid dependency. It's true. It's not made up. It's true, and it happens. And we have to be very selective in who we take, and we have to be more aggressive in noticing it. And what's happened over the last couple of years has been tremendous in helping us to the point that I have patients coming in saying, I don't want that medication. So you're at the right place. For the patient that says, I only need it, I can't live without it, I talk to them about, dependency, codependent, that you don't need it as much as you think. And we've weaned a lot of people off pain medications from that attitude. And the attitude is, it's not like just stop it. you have to have an alternative, something that makes sense to the patient, which I spent extra time on that first visit to explain to them what our philosophy is and what the importance of it is. And right then, I can tell if the patient's open-minded to it or they're just focused on getting their pain meds. If they're focused on getting their pain meds, they're really not a patient for us. So we pride ourselves in trying to help everybody, but sometimes if you're closed-minded and you just need that narcotic, this isn't the right place for you. If you're someone that wants to be open-minded, looking at other alternatives to be treated, then yes, this is exactly the place you're going to be. We'll guide you, but you have to do the heavy lifting. So the way medications work, I kind of said it quickly, when I give you an anti-inflammatory, which is like a Motrin, an Naproxen, and an Advil, things like Celebrex and Mobic, those are anti-inflammatories. So what we do is we cut down the inflammation around the nerve and the disc and the joints. If it's, I hurt my wrist or I have, pain in my wrist or my neck a little bit, we take a little Advil or Aleve. Over the counter is what you want. There's a role for Tylenol also, similar with a similar anti-inflammatory effects. We use steroids when we need a stronger medication. We need muscle relaxers when you just have that spasm where you just can't loosen up. That helps also. We have medications that help you sleep. I try to use certain medications which will cover two different things, especially if you have difficulty sleeping. We give a certain muscle relaxer that helps relax you all together and lowers down your spasms and relaxation. As far as narcotics, it's straight up. The difference between narcotics is they have different pathways. A lot of them you talk about a morphine base or a codeine base. Those are the simple ones. We use that within the system, okay? So it works on certain parts of the body, certain pathways to cut down the pain, just to kind of keep it simple. We don't like using that long term. Do we have patients that are on it long term? Yes. The other big thing we use is we're aggressive with our therapy, with our home exercises, but more importantly, I'm very aggressive on educating. Like I'll tell a lot of people I'm here to educate you so you know how to make a decision, because I'm not with you 24/7. So I try to educate you as much as you can, like when you're in a situation where, the simple thing is that I went to go lift something up and I spasm. Well, what happens? Did it go down your leg? Did it radiate? Did it just stay there? There are certain things that you can do to kind of correct it yourself. So we don't make, a lot of doctors like to make you dependent on them. I try to make you independent and understanding so you know what the next move is. And when it doesn't work, then we're here to talk to. But we're not here that you can't do anything without talking to us. That's not the attitude. So going into question 2, you've told me to research the PRP. I understand the procedure now, but am wondering how long after the procedure will I see results? Also, how much downtime do I need following my treatment? So it depends on what age group you're in. Obviously, if you're younger, you need less time. I have certain people, I haven't been able to predict it perfectly, but for the most part, I think PRP, which is called platelet-rich plasma, just to back up for a second, platelet-rich plasma, and how do we get that? We draw it from your blood. We take a certain amount of your blood, we put it in this special machine called a centrifuge. We spin it down, which is already calibrated to clear out the platelet-rich plasma. What we're doing is basically taking the healing properties from your blood that normally work within our system already and creating a higher volume concentration to put into the injured area. And we're seeing phenomenal results with that. So how long does the procedure take? It takes, for me, it's 5 minutes. We get in there, it depends on what part of your body we're injecting, and in a joint it's simple. We just get into the joint, we do everything either under ultrasound or x-ray, nothing's blindly done. I wouldn't go to anybody who blindly does injections on you. You need to someone that knows, because you're spending money where you want them to be as accurate and giving you the best optimal situation as possible. It says also what's the downtime. So downtime is usually I'll do the injection on Thursday. What I tell people is that you're taking it easy on Thursday. Friday is 25% activity, 50% on Saturday, 75% on Sunday, and back to normal on Monday. With PRP, you don't want to do any resistant activities for about 2 weeks because you want everything to kind of heal in. The thing is with PRP, we create an inflammatory response because that's the natural healing cascade of the body. So when we start talking about what's going on with the healing process, we want that inflammation because what that does, it calls all the other parts of what's in the blood to help heal also. So it's actually, we're inducing and creating a anti-inflammatory healing process, which actually creates what we call, I don't want to say, in the generic term, it's a regenerative process to get more healing, as opposed to our steroid injections where we get just a strong anti-inflammatory. There's no healing or regenerative property to that. Okay, so number 3, tips for fall, winter fitness, outdoors and indoors. So this is just a broad, simple question that, wow. I have people that won't leave the house after 75 degrees. I have people that won't leave the house after 50 degrees. I have others that just leave their house no matter what, and they wear shorts no matter what the temperature is. So this is really broad. So we're going to go for the majority, the people that won't leave the house after 50 degrees. We're still bundling up. We're in Michigan. Most people should be used to staying warm and active as long as possible. For me, I just, like right now, I feel like we're going to cheat the summer months because we're still being active, especially after the weekend we came off of with 75-degree weather. So there we're staying active. But it's the simple stuff. It's the biking, it's the riding. It's no difference. When we get into the winter months, we talk about cross-country skiing downhill, snowshoeing. Those kind of things are very active. You want to stay active outdoors. Hiking, walking, biking, running, all that's still active. For people with proper gear, our places, REI, they're all geared for all seasons now. So you can do almost everything. The biggest thing is to stay active. For the individuals who I think struggle, especially with some of my people that need sunlight for attitude, personality, I don't want to put the word out, that famous big D word, but that's where you really can find that people start getting a little bit down. They don't get their release, the adrenaline release. There's so many indoor places right now. Everything from the cycle bars to the Orange Theories, to one-on-one training, one-on-one stretching, kickboxing, all that. Everything works, okay? There's no special thing that I'm going to sit there and tell you is better than the others. I pushed yoga huge. I actually started doing yoga again, or I did one episode 2 nights ago, and I felt better than ever, and it made me mad that I kind of let it slide a little. But again, there's only so much time in the day, and during the summer, I'm kayaking and biking myself. So the yoga should be like a staple for a lot of people. The stretching is a staple. You wake up better, you feel healthier, and if I can add in the nutrition piece, that's huge too. So tips for fall and winter, no difference. You've got to get used to converting inside. I know they're selling a lot of the bicycle trainers where you put your own bicycle on the trainer itself so you can still put your miles in. These Pelotons are huge, the mirror's huge, all those things are motivating. But there's so many classes right now, there's so many things online right now. COVID, if anything, is going to make us get through our exercise program during the winter months so much easier. If you start a program during quarantine, those are the same kind of things you can continue right through the winter months. If you don't want to get out in the snow, if it's bad weather, we have no excuses. There's 0 excuses you can make, including myself, on why you're not working out on a routine basis. There's so many avenues, and if you are, then you're just looking for an excuse not to do it. So it's really on you. There's tons of avenues. You got to figure out what attracts you, what's interest to you, and what motivates you. So, all right. So question 4. What, if any, special accommodations do you recommend for school, home, or work pertaining to ongoing mild to moderate neck pain? So I'm not sure what we're asking here. I'm assuming you have mild to moderate neck pain, and how do I get through my school? How do I get through working on the computer and working at home? That's how I'm going to take this question.
Ergonomics.
Sorry. Basically, when I was on the radio, what was real big is something called text neck. Is with the forward flexion, things like that. You're always down, you're always looking at it. What that's doing is creating a weakness and changing your posture over time. So we're looking at a lot of young people, including my own kids, where their posture is changing. That upright posture, putting your neck back, putting your shoulders back. Even with me talking, you see that I'm forward flexed. That's not a good position to stay into. When you're on your computer, even more so. I have so many people that, they're looking down at their computer screens, at their keyboards, they're looking onto their screens. If it's altered, you have to be able to set up an ergonomically correct workstation. So you want, like Nicole right now, she's before bed, she's telling me she doesn't have a good workstation. So she's correcting it right now. Anyhow, it's true. It's not going to be the one or two times. But the biggest thing that's happened with this quarantine, so many people working from home, I have people that are now working from home 8 to 10 hours straight. And I've talked about this multiple times. You have to do something. You cannot do that. 20 minutes is your limit. I don't care if you're healthy or not. It's 15 to 20 minutes. If you can't remind us, like, oh my God, 2 hours went by, put a little thing on your computer, put a little timer that every 20 minutes is something's happening. What you want to do is, it's not like you need to get down, roll out on the couch and do things. It's just, rolling your neck out, letting the weight of your head move, letting your shoulders roll out, taking a deep breath, just being acknowledgeable. Like for me right now, I'm sitting here looking at myself. It's kind of weird, but I can see that my posture's off. That, like I told you, I have a forward flex posture. And if I get my shoulders back and that's like a whole different person. This is really where I should be and the way I should be talking to you. Is it comfortable? No, I feel a little weird, I'll be honest. But you have to do it, because what's going to happen is your spine's going to start getting more comfortable in that position, and it gets weak in the others. And so what happens is you see the little old ladies in the grocery stores that are all hunched over and forward. What they're doing is that you create an arthritis and a weakness, and you move forward so the spine opens up in that forward position. And what happens is that's more comfortable, so you just gradually do it. If you don't fight against it, you're going to lose it, which is the classic statement. So for school, home, and work, these are things that I'm assuming is that in front of the computer. You need to, one, get up every 20 minutes. That doesn't mean get up and stop working for 20 minutes. It's just take that 30 seconds, take that 60 seconds, roll it out, pull your head aside, push on it. There's so many things you can do. While you're sitting here talking, it could be rubbing your neck. You want to get into there very tight, like it's a tight muscle. You want to break it up. Rubbing it like this isn't going to do anything. You need to get in there and break it up like it's bad tissue, or like what I describe as bad dough. You want to keep beating it up until it softens again. Same thing with the muscles. That's exactly what you need to do. So you want to be able to be active. Roll your neck out. Take a deep breath. Just let it happen. And to be honest, the biggest thing, the reason I was pushing yoga at the beginning when we started doing this, it teaches you how to breathe again. So many people do not know how to take a deep breath. We should tell everybody to send in their best deep breath video, where you actually expand your whole chest with an inhale and let it out. My last yoga class I took, they actually said inhale but blow out even further, so you can get even a bigger inhalation next time. So it's expanding your lungs. Your lungs are like tubes. If you don't use them, you're losing the corners. You just stay with a small percentage of your lung. And that's one of the things that runs your body. It's your lungs and your heart that truly run your body. If your lungs are inefficient, if your heart, it's a cascade, it's a domino effect if you don't do it. So you need to stay very active in doing these things. So again, deep breaths, relaxation, roll your neck out, roll your shoulders out, understand your own posture. And if you do, like, I don't know what that means, you sit there, you put your shoulders back, you put your neck back, you can have somebody look at you. A lot of times I tell you to have a mirror off to the side, so you kind of look at, and then you draw a line where your eyes are. Or on your computer, you can draw your eyes where your line, and when you start falling down, there's this little line there that reminds you, oh, I'm losing my posture, get back up there. And sometimes you can even work on your core when you're doing it. Like what I want to do right now, I want to pull my belly in to strengthen my abs and my back in. So I'm actually working a core exercise with something called an isometric contractions. These are things that are going to improve you all day long and not become a marshmallow after 4 weeks of work, which a lot of people have become. And I'm sure some of you are out there right now listening saying, oh my gosh, he's right. And you've got to stay active. If they're at that computer, you need to move on. Okay? Number 5, how often would I need to come in for office visits? This is great. We've been treating people, our motto is we treat everyone like an athlete that has to play by Sunday. We're very aggressive. We're not that doctor who says, okay, nice to meet you, we'll see you in 4 weeks. No way. That I don't know if that doctor cares as much or wants to be invested. What I had to do at the beginning of my career to get the top athletes and get athletes is we had to be very aggressive and get results quickly. We don't wait 2 months. An athlete can't wait 2 months to get back on the field. We're seeing you within 1 to 2 weeks after that first visit. Number one, to make sure what we're recommending is working. If we're working with therapy, make sure they're doing the right thing. Medication, in 3 to 5 days, we know if that medication is going to help. There's no medication you need 4 weeks to see if it helps. Either they don't understand how the medication works or they don't have time to see you. We've always processed everything on a very quick, aggressive format. And if you're someone who doesn't follow that, then that's fine. But like I said, we treat everybody like they're an athlete no matter what's going on. Acting like you need, because I have a lot of athletes that had to be playing by Sunday. So that's the mentality for everybody. So we're aggressive, even with our elderly people that just want to start playing bingo again, or visiting with their friends, or walking their dog with their friends on Sundays or Saturdays, going to the dog park. Everything means something to us. It doesn't mean that you're getting paid $50 million to play on Sunday. It's what's important to you. I have so many patients that are saying, I can't lift my grandkid anymore. I had a guy today, or yesterday, with a shoulder injury. I can't lift my son up. That's important to him. I can't throw the football with him. For me, that was my big thing. I couldn't throw the football for a while. I had to rehab my own shoulders. So it's the attitude of the physician. Grade your physician. You can go and look at health grades and all that stuff, but the thing is, you can tell within a minute if he really cares what's going on. Anybody can fill out health grades and go from there. What you want to do, and we encourage you to fill out our health grades just for the record, but you need to be with an aggressive, we have a very aggressive format. So when you ask me how often, it depends on your schedule, our schedule, but we don't like, if I tell my staff this patient needs to be in within a week, they're back in a week. I don't care. We put you in, we find a way to fit you in. We work a little bit longer. We move things around to accommodate that. So we're very aggressive within 1 or 2 weeks, because what I want to do, nerve testing, I want imaging. People, like when I train, I've had fellows, residents, and students here in the last couple of months, and I explained to them hugely explained to them, these patients aren't here for they're wasting their time. There's something serious going on that they're taking their time out, especially during a pandemic, to come see us. The pressure's on us to figure out what's going on. And that's our challenge, and that's the excitement. So when I had a young medical student here last week, he was excited. He was an athlete himself. He's like, I wish I had this when I was being treated. I probably wouldn't have lost, he lost part of his career because of injuries. It just took longer. Or our patient from Wayne State, is one of the basketball players. And I'm not saying anything, but he was sitting idle for 6 months. And we started seeing him, and within 2 months, he's back on the court playing full court with no restrictions. It's just, you have to go to the right, like I've said so many times, you need to go to the right place with the right tools to fix your issue. For musculoskeletal, for spine, for neck, all the non-surgical stuff, I feel like we're the right place, especially with Dr. Bonat, Dr. Abrahamson, Dr. Khan here now. We have a great team with an aggressive attitude. If you don't want an aggressive attitude, we might not be that person. If you're like, no, I want to move at a slower pace, that really doesn't fit our model. We're not here to give you a medication, a narcotic, and we'll see you in 4 weeks. That's not it. We have to find a reason to give you the medication. We have to get you involved. You have to buy into what we're doing. You have to trust what we're doing. And we're going to make mistakes, but at least we got to get from that first step to know which direction we're going. Hopefully our first step works. Most of the time it does, but sometimes we have to shift gears. Sometimes we need a surgeon involved. Sometimes we need, some alternative treatments. I need an acupuncturist. I need yoga involved. I need a chiropractor involved. We have a whole team of people that we use outside of us. We take care of a large percentage of the issues, but we also know who to refer you out and when to refer out. So that's really what, I didn't answer your question. It's all dependent on the injury, but I'll tell you right out of the gate, the first time we see you, our goal is to see you within 1 to 2 weeks. After that, we see you at 2 to 3 weeks, and then we keep pushing out as you improve. If you don't improve, then we're shifting gears and we're going more aggressive, where we're seeing you every 2 to 3 weeks. So our hope is always to, we see you frequently at the beginning, we wean you away, and I'm not the guy to say, see me in 6 months. It's once you get past that 2 to 3 month period where you say, bye, send us your friends, but, let us know that you're doing what you need to do. So in the big picture, in the summary of the day, hopefully this has been helpful. But again, we use narcotics, we use opioids, but we use it appropriately, not for long term. Do we have patients on long term? A very small percentage. Our goal is always to get you on less. Less is more. We give you other alternatives to move into. So it's not like just stop your narcotics. I have so many patients, they just stopped it. We can't just stop it. I have to have you buy into, you got to help yourself. If you're someone who doesn't have that mentality, then it's going to be very difficult to be treated here. Proper body mechanics, ergonomics, talking about your posture, working at the computer, you're on your phone, you're texting, you have to be aware of it. You're going to get by for a couple of years, but I'm telling you, when you start doing 5, 10, 15 years of that, you're going to have a lot of neck problems down the road. The importance of individualized, it's hard to say how often we'll see you. If it's a simple injury and we can fix it, then great. But usually, unfortunately, when I see patients, they've already seen a couple other doctors. So it's usually a major individualized program that we focus for you. We put you with the right therapist. We put you with people that I agree with, who kind of have a team of people, outside of me. I can just tell you what to do and guide you, but I can't control you at home. So the big quote of the day kind of pushes just to that is, a good physician treats the disease. A great physician treats the patient who has the disease. So hopefully we fall more on the latter. We really look at the patient. I look at the patient as a whole. I do these other medical evaluations that I do. I see how other people are treating. And sometimes I feel bad for them seeing certain doctors, that just, I'm not knocking anybody, but sometimes the bottom line is you got to find the doctor that fits what your needs are. And if you or family members or anyone else are in need of that, like I said, we're taking on patients right now with Dr. Bonat, myself. It's freeing us up a little bit. We have a lot more flexibility with telemedicine to see people outside of our small region here. So feel free to spread the word and have a great time. Enjoy the weekend. Peace out.